if somebody breathes very shallow, it goes without saying, if somebody breathes very shallow, their oxygen level is going to be low because they're not bringing enough oxygen into their body. And because of that shallow breathing, they're supposed to be getting rid of a lot more CO2, but because they only inhale shallow, they can only exhale shallow, like a little bit. Meaning somebody that breathes shallow, their oxygen levels will be low, their pulse rate will be high. Okay? Now, oxygen therapy. So let's talk about this a little bit more in depth. You have somebody who has COPD, and the person's wearing supplemental oxygen, let's just say average 2 to 3 liters per minute. The person's wearing a nasal cannula. That person increases their oxygen levels, their oxygen intake, from 2 to 3 liters up to 5 to 6. Okay, so they increased it by, about 2 to 3 extra, maybe more. Because the person's feeling out of breath. And they didn't realize, they're not understanding, not realizing that out of breath is not caused by low oxygen, it's caused by CO2. So how does the body reject too much of anything? How does your body try to get rid of too much oxygen? In this case, 6 liters, 7 liters, yeah, that can be lethal. Okay? So, can it worsen symptoms? Yes, of course it can. Because how does the body reject it? Slows the heart rate down. Before I brought up some people with heart disease can be on oxygen. It's relatable to this. When you increase oxygen, the heart rate is going to slow down. How does CO2 from your legs, from your brain, from your arms, from any part of your body, how does the CO2 travel to your lungs so you can breathe out the CO2? Your heart does that. So you increase your oxygen, you're going to slow down your heart. It's just what's going to happen. You start slowing your heart rate down, okay? And it takes away the drive to breathe. It literally is a thing. You increase oxygen too much, it's going to make you feel good, right? So why would you even think about doing something as silly as increasing your own oxygen, and you're wondering why you go back and forth to the hospital? Your oxygen levels are fantastic, but your CO2 levels are all the way up to the roof. And why is that? Because you slowed your heart rate down, kept the CO2 climbing in your body because the heart rate wasn't moving the CO2 fast enough out of your system. You can breathe as fast as you want, but if the CO2 is not coming out as effectively, because maybe you have inflammation, maybe you have, IPF, maybe you have, as idiopathic pulmonary fibrosis, maybe you have a lot of other problems. But the thing is that you increase oxygen too high when it's not recommended by your doctor, as your doctor actually put in place a prescription, because oxygen is a medication, because too much of it will kill you. You increase oxygen too high, too much, yeah, it's going to knock out your respiratory drive, your drive to breathe. Another reason why people with COPD that wear a lot of supplemental oxygen usually tend to breathe very shallow. Because that supplemental oxygen is going to what? Is it going to threaten, is it going to worsen COPD? Some people need supplemental oxygen. Well, some people, they need the supplemental oxygen, abuse it. And then you have people that think, oh, let me use it when I feel like I need it. And when do you feel like you need it? How do you know you need it? With a pulse oximeter? You are not a doctor. You are not a respiratory therapist. And if you are, you would know very well from experience not to do something as silly as that. You do not increase your oxygen. I don't want to see you go into the emergency room with an oxygen level of a 210, which I've seen before, 210 if not higher, PO amount, with your heart rate going all the way up, CO2 levels above 45. It's maybe 60, 70, your pH is dropping all the way down. You're going to acute or chronic respiratory failure, and you're wondering why. Never grab something and say, oh, it's okay. I saw it on this thing, and I saw it on that. No. Gases are drugs, too. Too much of it will kill you.